So we're doing something different this year. We're having what's called a story slam. And it is really based on being a doctor from Annals of Internal Medicine. So we have some participants here who have volunteered to do a 5-minute story ahead of time. They have sent in their scripts and they'll be reading from it.
I hope everybody can hear me. Can you hear me? I'm sorry, when I saw Saba's message that came across about doing a story slam, I just kind of thought about reflections of my life. And so I also wanted to say you guys did a wonderful job, and I thank you so much for sharing your stories. But anyway, I was just thinking again, as I said, reflections of my life. So I'm just going to read a brief thing that I wrote. So during morning report, when I was a PGY2, there was a case presentation of a patient with an unusual purplish rash. The resident was so excited and looked up various causes of this rash and was told it was Kaposi sarcoma. We all pondered how this patient who was not white or of Mediterranean descent could have this. And we were just absolutely fascinated. How could this patient show up in a Kings County emergency room with this type of rash? Unfortunately, the next several months, I admitted a homeless man with interstitial infiltrates, and he was really short of breath. And I remember speaking to the pulmonary doctor and said, boy, why does this man have these interstitial infiltrates? He looks so sick. And it turned out after bronchoscopy, this patient had pneumocystis pneumonia. And by the time I became a third-year resident, my large public hospital was inundated with scores of patients with the immunodeficiency syndrome that later became known as AIDS. And I remember very clearly how we had open wards those days. We didn't really have very good infection control practices. And we just thought initially that second year how fascinating it was. And before it was over, it was just horrible. So, I don't know why, I picked infectious disease as my specialty to go into because I was still thinking that this epidemic was not going to follow me. And I really enjoyed the opportunity to make a diagnosis, and I felt I was healing patients with the right antibiotics. But little did I know as I continued my journey as an infectious disease physician that I would be dealing with dying patients and many with complicated social issues. I grew up during the civil rights era and during the Vietnam War, and I felt very strongly about the rights of all. But now I became the physician caring for the ostracized, discriminated people that no one cared for. And it became, I think, very fitting in my life because I ended up becoming a hospice doctor. I had learned quickly how to break bad news constantly and to deal with dying patients. I was never taught this in medical school. And all I knew was I was supposed to heal people and get them better. But as I look back now, I do not regret my career decisions. I feel privileged to care for these patients and to see how the care of the HIV patient has changed from a lethal disease to a chronic disease. It is so gratifying. I ran into one of my patients in the medical clinic. She's HIV positive. She has hepatitis C. I had cared for her for quite a number of years until I changed to my current job. Anyway, she showed me a picture of her beautiful son, who's 10 years old, HIV negative, the love of her life. She's about to embark on hepatitis C treatment, and she is HIV undetectable all these years. And I was so grateful that I had the opportunity to help this woman achieve some of the goals in her life. I only wish, in retrospect, that we had all those medications that we have now, because I think of all those patients who died, and we had nothing those days. I saw another patient a few years ago in the medical clinic who had a nodular lesion on his foot. And I guess this is very fitting because he was seen by somebody else who then sent the patient for a biopsy of this lesion by the podiatrist. The lesion came out to be Kaposi sarcoma. So then the podiatrist sent the patient to the oncologist. Then the oncologist said, did anybody do an HIV test? So what did you think? He was positive. And then that's how the patient came to us. And I thought to myself, boy, times have changed. We saw this disease so many ways and so many times, and we knew immediately what we were dealing with. But perhaps it's better now that we see less and less of this disease, and it's not so well recognized. But, you know, that's a better thing perhaps because we have effective therapy. But that's my story slam.